Good afternoon. It's a real pleasure to join you. This is my second time at IADE, and I congratulate the organizers on an absolutely amazing schedule of lectures. So my name is Fadi. I'm a plastic surgeon from Palestine. These are my disclosures. I'm a global key opinion leader for InMode, and the technology that I'll be sharing with you today is a technology made by InMode. I'm also a faculty at IMCAS. Specifically, I'm one of the coordinators of the IMCAS alert service. I always take an opportunity to plug that in a little bit so you guys can have an idea. This IMCAS alert service is actually free to use on the IMCAS website. So you don't need to be a paid member of IMCAS to be able to use it. And how it works is there's different themes that people can choose, and each theme has a series of coordinators that help sort of garner the discussion. And it can be on anything. You can talk about a complication you've seen within injectables and threads or an energy-based device. You just click on that to submit a new topic. There's a few questions that you're asked to fill out in terms of the specifics of the case. And you can see that we have thousands and thousands of presentations and submissions on the website. So why is a plastic surgeon talking to you guys about acne? The reason is I believe the end point of acne in many cases is actually a surgical disease, and that's acne scars. And scars are definitely within the forte of a plastic surgeon. And in fact, in my opinion, many acne scars actually require surgical techniques to be able to get very good results in conjunction with energy-based devices. So acne is a complex disease, multifactorial disease, and we know that the problem is we don't always have the best solution for it, especially the adult onset population, not necessarily just the adolescents. So in our experience, we know that in about a third of patients, isotretinoin gives us no response. We know that in about 55% of patients, according to Godchick and the Global Alliance on the Outcomes of Acne study, along with Michael Gold, 55% usually relapse within a 5-year period. And we know that depending on the amount of inflammation that the acne induces, we're able to try to prevent some of the scarring that occurs with it. But we know that when severe inflammation, isotretinoin is not the best for scar improvement. Probably at around 30% is what most experts estimate. Versus the technology I want to speak about, and that I've been using now in my practice for approximately 5 years, in over 500 or 600 patients, which is the Morpheus. And you can add to the Morpheus a variety of other synergistic options. So you may use low-dose isotretinoin. I'll present cases where I've done both, Morpheus with low-dose isotretinoin. But in many of my patients as well, I only use topical therapies or a topical antibiotic. And there's a very powerful response that we're seeing in terms of the results. I rarely get somebody who doesn't respond. Most of the patients in a 5-year follow-up so far do not relapse. Some of them do maintenance sessions maybe once a year or twice a year. And there is a significant amount of scar improvement, especially in the early grade 1, grade 2 post-inflammatory erythema and early atrophic scars. And the beautiful thing about this technology is that we can also expand it and use it as an adjunct to some of our other tools in acne scar revision. When my patients come to the clinic to have an active acne session, I use topical anesthetic for 40 minutes. You can choose the topical anesthetic of your choice. You can also use a benzodiazepine or some Pronox or some cooling devices if you like. And there's really no magic in the technique. It's a very, very straightforward, simple approach of utilizing different depths, different modes on the Morpheus, and different energies. And you just start to run it along the lesions. And people used to think for a long time that you can't treat active acne lesions with fractional radiofrequency. I always treat active acne lesions with fractional radiofrequency, and I've never had a problem, never had a flare-up or worsening of the acne. On the contrary, the results are very, very good. And I'm going to start showing you some of the results. So this is a patient who did use low-dose isotretinoin 2 times a week for 8 months, and she had 3 Morpheus sessions spaced 2 months apart. Here's another one. She did not have systemic isotretinoin. She used only a topical epiduo, which is a combination of adapalene and benzoyl peroxide. She had 3 Morpheus sessions spaced 2 months apart. Topical tretinoin, no isotretinoin there. You can see a lot of the early scars improve. The reason she has goggles on, by the way, we had just finished the Morpheus and she was going to do laser hair removal. So that's why. So she had 4 Morpheus sessions, very, very safe in dark skin type. This is a patient, she took low-dose isotretinoin 2 times a week for 8 months. She had 2 Morpheus sessions. Notice the improvement in facial structure. Okay, we didn't inject this patient with any hyaluronic acid. It's just by controlling that inflammatory disease and minimizing it, it allowed for her collagen to remodel, for her hyaluronic acid to reintegrate. And she's a young girl, so she doesn't need to be pumped full of gel and other treatments. Usually just taking care of the disease and stimulating collagen and elastin in the skin is enough. Here's another patient, low-dose isotretinoin 2 times a week for 8 months, 3 Morpheus sessions, very excellent skin quality improvement. And her next step now, she's going to undergo face tight to try to define that lower third a little bit more. Here's another one with low-dose isotretinoin 2 times a week for 1 year, 5 Morpheus sessions spaced 2 months apart. She's one of my earliest patients, and she has had no relapse. In dark skin, it's quite safe. This is just 1 Morpheus session. This is also low dose, 10 milligrams 3 times a week for 8 months, and she had 3 Morpheus sessions spaced. This is topical epiduo. This patient actually failed isotretinoin. She took isotretinoin 3 times and failed it. This is topical epiduo again, and 3 sessions of Morpheus. This is one of my favorite combinations when I want to target acne, but also when I want to rejuvenate the face. So this is a combination of Morpheus, so 2 sessions of Morpheus, and 1 month after the last session of Morpheus, I injected diluted radius, which is a very powerful biostimulant. And no filler at all. She has excellent structural improvement. Malar support is better. Very good augmentation of the tissue. We have a very large African population in Palestine. They originate from Nigeria. So this is a FITS-5, FITS-6 patient. She failed isotretinoin 2 times over a 4-year period, continued to get relapse and scarring. And I did Morpheus sessions and topical tretinoin alone. She didn't take anything systemic. Excellent improvement in her scars. Even the more inflammatory pictures as well. And often in the adult onset cases, there's probably some Demodex going on as well. So there's a lot of thought now that acne and acne rosacea are just kind of continuations of each other. But we see it also in these active inflammatory lesions, and they get very, very good improvements. So you can see in multiple skin types, excellent improvement even in the facial structure with a little bit of tightening, especially in the younger patients. And so this, after treating her with 2 Morpheus sessions, we can then progress to do some acne scar revision for her. And there are many options for acne scar revision as well. Again, no injectables, no medication, just 3 Morpheus sessions for this patient, 2 months apart. So it's a technology that I've had in my clinic for a very long time, and I have a lot of experience with it. And you can see excellent response. This is actually one of my recent case of another dark-skinned, relatively dark-skinned patient. And she just had Morpheus. Absolutely no systemic therapy. She had 3 sessions, spaced 2 months apart. Okay. What about acne scars? Well, there is no single solution that can be applied to all acne scars that will solve every acne scar and every problem that we have. Acne scar or approaches to acne scars are all about combinations. It's all about combining certain surgical techniques in addition to biostimulatory products, in addition to energy-based devices. On the same platform, the Embrace platform where you get the Morpheus, we have an extension of a very small internal bipolar probe. It's called Accutite. And as we know, one of the key elements of a good surgical acne scar revision is the process of subcision. Because what you end up doing is you end up cutting a lot of the fibrosis that is pushing the soft tissue down onto the SMAS, sometimes even into the fat it reaches. So what I liked about this approach when I developed it is I'm actually using the RF energy internally at a very low setting to help break that scar faster and allow for stimulation of fibroblasts and collagen remodeling. So it goes something like this. Basically, you set up your machine and you apply a little bit of tumescent using a cannula into the patient's face. And then there are very specific internal and external temperature controls. This is a very controlled treatment. It's not random. I know exactly the depth I'm at. I know exactly where the temperature and the heat is traveling. And I know exactly the kinds of temperature my cutoff is going to reach. It does not allow me, the machine, to heat more than a specific kind of temperature. And the patient can't feel a thing. She's numb. And what I'm doing in my retrograde pass is I'm delivering that little bit of internal RF. And so I'm getting both a mechanical subcision through the internal probe of the accutite, plus a very little bit of radio frequency energy to just break that scar down and help remodeling a lot of the superficial skin scars. And you can combine this with anything you want. You can combine it with Morpheus. You can combine it with CO2. You can combine it with biostimulation. You can combine it with fat. I do a lot of TCA cross for the ice pick scars. So acne scar revision, it's really about combinations of multiple processes to try to treat the different aspects of the atrophy. So very, very easy to do. It takes about 5 minutes, and the results are quite outstanding. So the rationale, again, is that subcision is a key procedure for acne scar revision. And you absolutely have to release the tethering of the scars in order to be able to develop that collagen remodeling and to lift the atrophic parts. So what's happening is you're inducing a coagulative necrosis in that area. You're actually firming up the septa, and you're getting skin tightening as well as fibroblast stimulation and collagen coming in together. But again, it's all about combination. There is not a single one shop pony, as they say, that is going to fix all of the scars immediately. So this is an example that's in our paper that's coming out in September in the Aesthetic Surgery Journal. So you can see that she has a variety of box scars, very, very strong rolling component. And this is, I did exactly what I showed you. I did an internal accutite subcision, and we did external Morpheus for her, 3 sessions. And I also used a little bit of biostimulation in the form of diluted radius. Here's another case. She had, I'll take you through the process here. She had the inflammatory acne. She had failed actually multiple courses of antibiotics, kept getting recurrence. She also tried isotretinoin once. In this case, I gave her a topical therapy, Epiduo, multiple Morpheus sessions to get her up to about this point, the second picture. Then multiple TCA crosses, that internal subcision that I showed you, Morpheus externally, a little bit of biostimulation. She's going very strong. She comes in every 1.5 years just to maintain the therapy. So again, the idea is that in about 1/3 of patients, especially in adult onset acne, even adolescents, you will have a very high recurrence. And the other problem is that, generally speaking, drugs alone are not ideal for scar remodeling. And the earlier you're able to target the scars, the much less that scar burden will be in the future. But if you are faced with a chronic scar, we have a lot of options to improve it, as long as the patient is aware that it takes time and that the process has to focus on more than one theme of treatment. What I love about Morpheus is it's easy, it's safe in all skin types. I actually see the significant improvement in the quality of the skin, as well as the acne and the scarring that happens. And although I get some relapses, patients are quite happy to come in once every 6 months or once a year to have the treatment. It's a very superficial treatment. We're not going deep here. We're not going to 3 millimeters or 4 millimeters. It's really a 1 millimeter treatment with very, very low energy, using something called cycle mode, where the needles come in and come out again. And what we're targeting there is an ablation of the sebaceous gland. But also over time, we know many studies have shown that several of the anti-inflammatory cytokines get released after exposure to that energy. So I wanted to share with you my experiences, tell you about this really cool technology, and thank you so very much for listening.